Okay, the first question is about the menarche. What is the menarche? The menarche basically is the first menstrual period, that is the female, and it marked the onset of which one? Onset of the reproductive capabilities. It means that reproduction has been started. The reproductive capability has been started. The menarche, if you will say, the average age will be 12 to 13 years, and the normal age will be around 9 to 15 years will be. We having the early menarche, when we call it early menarche, that will be around before 9 years. Before 9 years. Then this is known as the precocious puberty. The early menarche is known as the precocious puberty. So there is a one question also as well. Precocious puberty means we have the early menarche, and we have the late menarche as well. The late menarche. The late menarche means after 15 years. After 15 years. We call it as the late menarche. And also there will be having the, depends on the bleeding, depends on the puberty, the menarche, the duration, so that can be changed. So that we have taken the average. The average is 12 to 13 years, and normal range is from 9 to 15 years. Usually in average girls, you will get the menarche from 12 to 13 years. But if you say the normal range can vary from 9 to 15 years. The urine becomes curd. Okay, the curd or the cloudy urine means there will be having the proteins. Plus we will be having the edema, that is swelling of the lower limb, plus hypertension. So that is seen in the pre-eclampsia condition. This condition is seen in the pre-eclampsia condition. Then you have the 4 to 5 week pregnancy, the rheumatism in the children. 4 to 5 week pregnancy, the patient will be having the rheumatisms. So in this question, they have asked about some inpatient treatment. So for that, we have to start firstly 8 to 12 weeks, then 28 to 32 weeks, and then next dose will be given at the 37 weeks. Okay, so this is a direct question you have to revise. After that, there is a question on the lactational mastitis. What is lactational mastitis?
इन्फ्लामेशन पोस्टपार्टम पीरियड में भाई जब वो इन्फ्लामेशन हो जाती है इसकी mastoid gland.
It means inflammation of the breast tissue during the lactation. Okay, not postpartum. So during the lactations, that if there will be the inflammation of the breast tissue, that is known as the lactational mastitis. What you will see, it is associated with infections. Okay, the causes can be, what can be the cause? Like if the milk stasis are there. The cause is what? Milk stasis. That is the most common cause. Okay, that incomplete emptying of the breast, that will cause the lactational mastitis. If any nipples, crackles in the nipples, that is the entry point for the bacteria. If any crackles will be in the nipples, that will create the bacterial opening, and that will lead to the infective. And due to that infection, there will be the inflammations. Okay, what is the most common organism that causing the lactational mastitis? Which is the most common organism? What?
Staphylococcus aureus.
Yeah, that is the Staph aureus. Very good. That is the Staph aureus will be there. And then other than that, Streptococci, E. coli, they can also cause the lactational mastitis. What you are going to see in the symptoms? There is the painful conditions, swelling of the breast, red and warm breast will be there. Other than that, you see the fever, malaise, flu-like symptoms, usually unilateral, and it may progress to the which condition? Breast abscess. If you are not able to treat this condition, it can progress to the abscess in the two ladies. Okay, what the management? There is one question that what will be the management will be there in this lactational mastitis.
Feeding, expression of breast milk, and fissure treatment.
See, I told you what is the most common cause of milk stasis. So if the milk stasis is there, then what you have to do? That you continue the breastfeeding, okay, and pumping to relieve the milk stasis. Or if that is infective conditions, then you can start the antibiotics like dicloxacillin. And if MRSA is suspected, then start with the clindamycin. And along with that, if it is a painful condition, you have to start the analgesic like the paracetamol and the ibuprofen. and the warm compression also you can put. These are all your questions in the Krok. Are you able to see the screen? Can you move the cursor where you want to enter the text? So in next question, we have the dolichocephalic plus tumor between the pre-fontanelle and the post-fontanelle. So this, what is that? Basically, what the position will be here. That if you see the dolichocephalic head, it means we have the elongated head shape. In the elongated head shape. And if the tumor between the pre-fontanelle and the post-fontanelle, then this is the supracellular mass, like the midline. Okay, the tumor between the in the midline. And the midline tumor, we will classify it into the which tumor? Craniopharyngioma. Which tumor will be there? That is the craniopharyngioma. Craniopharyngioma. And craniopharyngioma, remember, it arises from which pouch? Rathke pouch. It arises from the Rathke's pouch remnants. It arises from the Rathke pouch remnants. Okay, then if you ask about the presentation in this, the presentation will be the vertex presentation. Now you will tell me what we will call the presentations. What is presentation?
Vertex.
That is the vertex presentations. Okay. The vertex presentation, and it will be present the craniopharyngioma, that will be the posterior vertex presentations. Okay, so that you have to remember. The presentation I explained you, I think in the voice chat last day. Then the next question, ultrasonography. I don't know what was the questions. And also remember, the vertex presentation is the most common and optimal fetal presentation for vaginal delivery. The posterior means posterior vertex, or vertex means basically the fetal head, that is the occiput, is flexed. And that's why you will see the vertex, that is the presenting part. What will happen? The fetal head, like basically the occiput, that will be completely flexed. So what we will see? We will see the vertex presentations. The presentation basically means when we are doing some examination, so which structures we are presenting, or which structures you are presenting to us, is known as our presentation. Then we have the foamy leukorrhea. The foamy leukorrhea is seen in which condition? What is colpitis? What is colpitis?
Inflammation of vagina.
Inflammation of vagina and and we will see the foamy. Yesterday I told you, I think here. So we will be having the trichomonas vaginalis. We will see the colpitis macularis, that is the strawberry vagina. Then we have the candida vaginitis. You will see the curd-like white cheesy discharge will be there. And if the bacterial vaginosis, then they will see the Gardnerella vaginosis, thin grayish or the dirty white glass, and it will be looks like the fish odor smell. Then remember, if you will be having here, that is the foamy leukorrhea. The foamy leukorrhea is seen in case of the trichomonas colpitis, or colpitis may, or we can say vaginitis, or the trichomonas vaginalis. Okay. So that you have to remember. Other symptoms you will see, the patient will be having the dyspareunia, they have the dysuria, the abnormal discharge will be there, and vaginal bleeding or spotting can also be there, and the most familiar, that is the strawberry vagina. The 59-year female. If this is the question, they see. Now, if you have practice notes for the question, that in the question the just age is given. The 59-year. What do you think about from this age? Which conditions can be possible?
By carcinoma, endometrial
carcinoma. So basically we will be having the post-menstruation condition. So post-menstruation condition, it can be endometrial carcinoma. And so for that you will do the diagnostic curettage to check up for the diagnosis. And so what you will do, diagnostic curettage will be done in this condition. So that's why I'm saying that for gynecology, the age factors is very, very important. If you firstly you have to check about the age factor. Higar dilator is used for Higar dilator is used for मेरे बताओ भाई. Okay, before tell me, if you have the diagnostic curettage, then like basically you have the DNC. So this is the procedure that is used in case of with the post-menopausal bleeding. If any post-menopausal bleedings, then you will do the DNC. So there can be the endometrial cancer, endometrial hyperplasia, and the endometrial polyp can be there, and other uterine abnormalities can also be possible. This is like if the age is 59 years. Okay, and what we will do in the DNC? That is the cervical dilatations. Okay, after that, what to do? Scrapping or the suctioning of the endometrial lining using a curette. Okay, and after that, once your DNC is done, this sample is sent for the histopathological analysis where you will check about the abnormalities. Okay, tell me about the Higar dilators. अरे बोलो भाई हिगार डायलेटर यूज फॉर
सर्विक्स डायलेशन के लिए यूज करते हैं टूल.
ठीक है, तो हिगार डायलेशन इज दैट इज अ मेटल रोड लाइक इंस्ट्रूमेंट. ठीक है, बट व्हाट इज यूज फॉर सर्विकल डायलेटेशन फॉर असेसिंग द सर्विकल पेटेंसी and for sometimes for uterine sounding also. So therefore you can remember that the patient for the cervical dilatation. And when you use the for the cervical dilatation before DNC, okay, for abortion procedure, like if you are doing some IUCD insertion or hysteroscopy, so in case of the cervical stenosis, the narrowing of the cervical stenosis, then we will use the cervical dilatation or Higar dilatation. Okay, so you can remember H for Higar, H for hole opening. Hole की opening करने के लिए what will use? We will use the Higar dilators. Or sometimes you can use this word that they use for the uterine problem. Okay, and assessing the cervical patency. Assessing the cervical patency. Okay. This is the disseminated form of endometriosis that we already discussed. Then we will be having the incipient abortions. What is the incipient abortion? Incipient abortions. What will happen in incipient abortion? बोलो भाई. देखो, if you say the incipient abortion, we have discussed the inevitable abortions. Inevitable and incipient, you will say that this is the stage of what inevitable abortion. Okay, where the process has started but not complete. And what will again I for I, whenever see the incipient, when you see the inevitable, the cervix os will be open. Will be open. Okay, the abortion will be in progress. They cannot be stopped. Okay, all these things we have discussed already in the main lectures. So here, incipient abortion, you have to remember cervical os will be open. And what will be the uterine size? What will be the uterus size?
एज के बराबर ही होगी.
So that is what we will be having. Uterus size correspond to the term of the gestation, and it is what? It is the irreversible conditions. Okay, tell me about what is the physiological amenorrhea. What is physiological amenorrhea? Simple. Physiological amenorrhea. हाँ बोलो बोलो.
भाई पीरियड्स नहीं आते बिना किसी डिजीज या उस कारण, या जैसे पोस्ट अपने आप ही मेनोपॉज हो जाती है, जो पोस्ट मेनोपॉजल.
Physiological amenorrhea. There is a firstly it will be the not pathological.
Hello?
Yes.
Physiological amenorrhea occurs during breastfeeding, like when a woman has had a baby and she's still breastfeeding, so it's likely she will not see her period. So a physiological amenorrhea
Yes. Okay, you are correct. But before that, also you can take the example of the pregnancy. And a pregnancy also create what? That is the physiological amenorrhea. You are correct, but breast after that we have the breastfeeding. After that we have the menopausal stage where we will see the
Okay,
physiological
sir.
cessation of the menstruation.
Okay, sir.
Before that, before pregnancy, we will be having the pre-pubertal, means before puberty. This is the normal life stage, a normal condition, not associated with any what, not associated with any of the pathology, any of the infection. So that is what we have the physiologically. That case, firstly, it has occurred before the puberty. There is no menstruation in young girls until the puberty. Second, there is a pregnancy. That is a pregnancy-induced amenorrhea, and this is why the pregnancy-induced amenorrhea occurs due to increased level of which hormones?
Progesterone.
Progesterone followed by
Prolactin.
HCG. ठीक है, women gonadotropin hormones. So then we have the postpartum, that is where amenorrhea following childbirth. So after the childbirth, if there is a exclusive breastfeeding are there, that is also causing the physiological amenorrhea. What is the pathological amenorrhea? Due to some hormonal imbalance, either due to some conditions like the PCOS and a polycystic ovarian syndrome or hypothalamic dysfunctions. Here the management, again, no treatment required. Firstly, you have to check about the managing the postpartum lactational secretions. You have to change the transitional to the menopause. So based on that, we will start the treatment. Otherwise, no treatment has been started. Then you have the cancer of the cervix. What is the key finding of the cancer of the cervix? If you have studied the questions, tell me just one keyword.
Cauliflower.
Barrel shape.
Barrel shaped cervix. Barrel shaped cervix. Other things?
Other by इसमें पेनलेस कंडीशन होगी, कुछ ऐसा गिवन होगी, मतलब
Vaginal bleeding.
What? थोड़ा तेज बोलो यार.
Vaginal bleeding.
So basically, we will be having the cervical cancer. Cervical cancer is caused by
human
human papilloma virus, that is typically 16 or 18. 16 or 18. Is it associated with smoking?
No.
Yes, it is associated with smoking. Is it associated with multiple sexual partners?
Yes.
Yes, it is associated with the history of STD. It is also associated with the history of OCP use. What you will see that the abnormal vaginal bleeding, that the postcoital, intermenstrual, or the postmenopausal, all are possible. And also remember, if you have the cancer of the cervix, it is more common in young female. Again, the age factor in young female post pregnancy, which is more common. Which age is more common?
Young.
Which age is more common for cervical cancer?
40 to 50 by.
Anyone else? Bolo. So if you say the cervical cancer, so this incidence increases with the age. Okay, but the risk of cervical cancers, it present earlier. Okay, and if having the persistent HPV infection over time, then there is high chances. But if you say the peak incidence will be seen at the 45 to 55 years. Okay, but it can occur earlier as well. So the main age like that will be 45 to 50 years, but also see we can also see in the reproductive age. The basal temperature monophagic. If you see some monophagic temperatures, basal temperature. So what it means? It means that we have the anovulatory menstrual cycle. There is no ovulation will occur. So we call this as the anovulatory menstruation cycles. Okay. After that, if we will be having ischemico-cervical insufficiency. So if we will be having the cervical insufficiency, what we will do? What you will do in cervical insufficiency?
क्लार्ज सर्वाइकल क्लार्ज वो सूचने कर देते हैं भाई.
If you have the cervical insufficiency, we will use the sutures or the uterine cervix. Okay, this is done in the operation theater only. Okay, so this is the cervical insufficiency, or sometimes we call this the cervical incompetence.
Incompetence.
Like in the, if she is pregnant, in the question they will give the she is one pregnant lady having the not unable to maintain a pregnancy until the terms, and so what it lead to premature cervical dilatation, or it can be the spontaneous abortions or the preterm birth. Okay, so it will be basically premature cervical dilatations. So to prevent that, what we have to do? We have to surclass a surgical procedures that usually take around 30 minutes, and we will do the usually we do the McDonald surclass to place the suture of the uterine surface. There is a one already prepared suture is there, that is known as the McDonald suture, and we will put that McDonald sutures, and with the help of that we will tighten the cervix until the term. Then you have the placental defect plus hemorrhage will be there. Then what we will do? Placental defect is there plus hemorrhage is starting when bleeding is there. What will be? Manual uterine cavity. So we'll do the, by putting our hand inside, we will clean the uterus. So that is the manually. Then 54-year-old, then what we are going to do? Again same question thing, fractional biopsy of the lining of the uterus and the uterine mucous membrane. Why we are taking that? Because of the endometrial, to rule out the endometrial carcinoma. What is secondary para? What is
2-time BB हुआ है pregnancy.
Okay, second time pregnant, we have the secondary para, plus this have the history of the cesarean section, plus you have the post-surgical pain. The post-surgical pains is there, plus cesarean section, so there is a high chances that she can develop the some complication. So if history of cesarean sections, follow the cesarean section. Pain in lower abdomen plus radiate. I told you already that if any questions upon the cesarean section, follow in most of the questions, cesarean section will be the answer. The Ukrainian people, they love to do the cesarean section. The pain in lower abdomen plus it radiates to the rectum and peritoneal symptoms is positive. So what is that?
Rupture of the ovary.
Rupture of the ovary. See, the pain in the lower, the patients came with a complaint of the pain in the lower abdomen that radiates to the rectum. So it's, she can say that she not able to sleep as well, or she not able to lie down because of this pain. Then we have the peritoneal symptoms is positive, or peritoneal irritation. Bloomberg sign is positive or not?
Positive.
Positives. Okay, because peritoneal symptoms are positive, the peritoneal irritation will be there. So if you see there is a sudden pain in the lower abdomen, you will see there will be this sudden hemorrhage will be there, or the rupture of the any ovarian cyst are there. That is known as the ovarian apoplexy. So what is ovarian apoplexy? If any sudden hemorrhage or rupture of ovarian cyst that is leading to bleeding into the ovary or peritoneal cavity. Like for example, we having what? We having one ovarian cyst is there, and this ovarian cyst is suddenly rupture due to some region. Okay, and due to this some regions it rupture, this bleeding that happened there, it will accumulate in the ovary or into the peritoneal cavity, and that is what is known as our ovarian apoplexy. Okay, we also call it ovarian torsion or the ovarian rupture. What are the causes of that? The causes is the ovarian torsion itself. Means if you have the twisting of the ovary, if the ovary will be twisted, what will happen? It will reduce the blood flow, it will reduce the hemorrhage, and so that will lead to the apoplexy. If you have the polycystic ovarian syndrome, so due to formation of the multiple cysts, that can be the one of our region. Then pregnancy. In pregnancy, what is the region of the apoplexy of the ovary? To the rupture of corpus luteum. There is a cyst, corpus luteum cyst during the early pregnancy. If that will be ruptured, that again cause bleeding, and the bleeding will be stored in the ovary or the peritoneal cavity. Or if any trauma or injury to the abdomen, that can also lead to the apoplexy of the ovary. What will happen? There is sudden onset unilateral. Usually it is unilateral severe lower abdominal pain. The pain that will be usually what? Unilateral. Plus, you will see there is a pelvic tenderness and the distension of the pelvis. The pain will radiate to what? To the rectum regions. The patient also can be having the nausea and vomiting due to peritoneal irritation. If there is a heavy bleeding, so there are chances of the shock as well due to severe blood loss. Their vaginal bleeding may or may not be present. Again, vaginal bleeding, there is a don't see in the question about vaginal bleeding because this is not a specific sign. Okay, is that clear? What the management
Yes.
you will do? Firstly, you will do the conservative management. Okay. Then, if the surgically you have to do, you have to go for the laparoscopy, remove the cyst and control the bleeding. Or either you go for the laparotomy. If you have the significant hemorrhage, the patient is going to do the laparotomy. Okay, because there is a high chances the patients can go into the further hemorrhagic source due to massive blood loss. There are high chances ovary will be damaged. The patient will go to infertility. If there is a ovarian blood will be there, infection will be there, that can cause a severe peritonitis. So apoplexy, what we have seen, acute pain, ovarian rupture, and the so. Acute pain plus ovarian rupture plus so. Proof to proof. Okay, the one question that Swati had sent in the group. So, what is the pedicle torsion in the cyst? What is pedicle torsion in cyst? And why this is not the answer? See, the ovarian torsion, I told you that it can be the one of the reason of the apoplexy ovary. So the difference between the pedicle torsion or the difference between the ovarian apoplexy is that ovarian torsion, it is the cause of apoplexy of the ovary. The pedicle torsion is same thing that the twisting of the ovarian cyst. On the ovaries itself, that around the supporting ligament. Supporting ligament is known as the pedicel. If there is any twisting of that ligament, that is leading to the reduced blood flow, and that can lead to the apoplexy of the ovary. So the difference between the apoplexy and the ovarian torsion is that ovarian torsion is basically the cause of what? One of the cause of apoplexy of the ovary. If you have the large ovarian cyst, there is a high chances of the ovarian torsion. If ovarian mass is there, then there is a high chances of the ovarian torsion will be there. Okay, the symptoms again will be the same, but the difference, the minor difference. Let's see the question here. The sharp pain in the lower abdomen, okay, the pedicle torsion in a cyst, you have to make the answer when there will be the, or when they will classify that there is some twisting or something is occurring with there, and if it is a large ovarian cyst are there, then you have to mark that the pedicle torsions. But usually you don't have to think about the pedicle torsion. You just mention mark the answer ovarian apoplexy if that in the options. Okay. And if you want to, you can write it like that only. That also. If this is in the options, ovarian apoplexy is in the option, mark that ovarian apoplexy. If that is not in the option, mark the pedicle torsion. Okay. The next one, 14-year-old plus profuse bleeding plus hemoglobin decrease, RBC decrease. What is that 14-year-old? What is the answer? What will be the answer? 14-year-old. What will be the answer?
Juvenile bleeding.
juvenile bleeding. Profuse bleeding, hemoglobin decreasing, RBC decreasing means that is the juvenile bleeding. Why there is a decrease in hemoglobin RBC? Because of the post hemorrhagic anemia. Okay, that's why you're saying age is main factor. The retracted nipple, unclear pain. What will be there? The nipple, retracted nipple. Okay, just tell me the some keywords for the breast cancer. If you have watched the lectures, main lectures, then tell me.
Lemon tint color.
That is the pure orange.
Beauty orange.
That is the pure orange. But I am asking you the some keywords for the breast cancer.
भाई राइट आउटर क्वाड्रेंट में वो साइज बड़ा होगा, लेफ्ट में कहीं भी मास होगा.
Painless.
The painless, most common presentation will be the painless lump. Then we have the nipple. What are the nipple changes? There, if the any retraction is there, discharge is there,
Inverted.
or the scaling. The scaling is in like in Pagets disease. Okay, what you are seeing? If there will be the retracted nipple, or it can be the some discharge from the nipples, or there is some scaling is there. Then these are the some symptoms presentation of the breast cancer. What other things you will see? They will see the breast skin changes. You will see the redness or the dimpling of the nipples or dimpling of the breast. That is seen in which condition? Dimpling. Again, pure orange. Pure orange. And other than that, you will see the axillary lymphadenopathy that is indicated of the metastasis. Okay, what is the how you will make the diagnosis for the breast cancer?
Mammography.
Mammography is standard tool for women more than
40
how many years? 40
40
years.
या 50 years.
40 years. Not 50 years, more than 40 years. खाना बाद में बना लेना. मैंने भी खाना नहीं खाया है.
ठीक है.
पहले पढ़ लो फिर खाना बना लेना. पर वो भी पता नहीं मिलेगा नहीं मिलेगा. Then we'll see the pain plus infiltrations plus body temperature is 38.5 degrees Celsius. So if there is see the body temperature, that is increase. Okay, I didn't mention here, but this is the pain. If what is the acute purulent mastitis? What is mastitis basically? First of all,
Inflammation of the breast tissue.
So in the question they will mention about that we will be having the inflammation of the breast. So there will be the pain. Breast pain will be answer here. You can say that will be the breast pain. Plus they will see the infiltration. So acute purulent mastitis, basically we have the bacterial or viral.
Bacterial.
Of course, purulent is there, so this is the bacterial infection. So in the breast tissue, what will happen here? The patient will be having the breast pain, redness, and the swelling of the breast. The infections can result in formation of the pus. Okay, what is the most common causative organisms? Most common.
Staph aureus.
Staph aureus. The most common is what? That is the Staph aureus. Okay, agar less common is the Streptococcus or E. coli. Sometimes you will see the in the question they will mention that there is some crack or damaged nipples are there. The crack or damaged nipples are there. That is causing what? Bacterial infections. The risk factors again here the lactation. In the question they can mention that she is a lactating mother. Okay, or if during the breastfeeding they can mention that during the breastfeeding some nipple fissure or trauma has occurred. They can mention in the question that patient is having the poor hygiene or infrequent breastfeeding. Okay, what other they can mention? They can mention that patient is having the blocked off, then milk is not coming from the nipples. So that means the milk duct is blocked. Okay, and they say again the history of the smoking can also be there. That will impair the immune functions and that indirectly causing what? Mastitis kind of the problem in this female. If she is immunocompromised patients, immunocompromised like if she is having the past history of the diabetes, she having the past history of the HIV, so that can also lead to what? That acute purulent mastitis. So they will again, so due to that, you will see the localized breast pain, swelling, nipple discharge, fever, chills, and abscess formations can also be there in complicated cases. Where you see the fluctuating mass. Okay, the fluctuating mass will be there. That means they're the abscess they are talking about. Then we have the big formation in the pelvis plus one-sided ovarian tumor plus omental metastasis. So what will that? The ablation of the omentum. Okay, so big formation in the pelvis, one-sided ovarian tumor, omental metastasis. So what you have to do? Ablation of the omentum will be done in such cases. Then we have the fetal bladder absent, cervix is 1 centimeter low. So what will be the answer? If the cervix is 1 centimeter long, what will be the answer? Did you study about the primary uterine inertia?
यस भाई
क्या था?
वीकनेस हो जाता
Weakness of what?
ये सर्विक्स डायलेट नहीं हो पाती
But you are
जैसे
talking about the uterine. Primary uterine inertia basically means where the uterus will fail to contract effectively during the labor. The labor has started, but uterus is not able to contract effectively. Due to that, what will happen? Weak or absent uterine contraction. Weak or absent uterine contraction, and that will result into the prolonged labor. Okay, and due to that, the first stage of the labor will be failed, or the very much time will be occur in the first stage of the labor, and this is condition will be seen in the high parity having the multiple previous birth. Okay, G4, G5 gravida having a more high risk. If the patient is having the fetal malpositions, basically this is occur in the occipito posterior position. If the twins are there, then can also lead to the primary uterine inertia. Because why this? Because this uterine, they will create some pressure in the bladder as well. And due to that, you will see the weak, ineffective contractions, prolonged first stage of the labor, soft or flaccid uterus will be there. So that is what that's causing the primary uterine inertia. Cervical surclass, then this question, forceps operations. Forceps operation is done in which cases? What is the forceps delivery? When you use the forceps?
जब बिल्कुल भाई लास्ट वाली स्टेज आ जाए और वो
So if there is some fetal distress, maternal exhaustion it will occur, or the failure to progress in the labor. So in all these cases, what you will do the forceps operation. Okay, the fetus is going the bradycardia, sign of hypoxia is there. Okay, maternal health issue like heart disease, hypertension, and like if there will be the heart rate or hypertension will be problem, then mother will not able to put maximum effort. Due to that, we have to use the forceps operation, or the forceps delivery. And there is a type of the forceps also there, but no one will ask you here. So just remember forceps operations, what they will do, they do the complete cervical dilatation. The next one, history of the right ovarian cyst plus painful formation in the right of the uterus, round, elastic, and mobile formation. Therefore, in this question, if you will see, there will be no option of the ovarian apoplexy. Okay, just there because there is no bleeding, painful formation on the right of round, elastic, and mobile formation. It means it doesn't rupture till now. So it means that we have the right ovarian cyst. The patient is history that maybe find on the ultrasound or before. But due to that, you are seeing now painful formation where on the right of the uterus. So this is the right ovarian cyst are there, round, elastic, and the mobile formation with the pedicle torsions. Like you have the ovarian torsion will be there. The primary gravida acute phlegmonous appendicitis. What will be there? The acute phlegmonous means we have the bacterial appendecta infection of the appendix. So what they will cause? It cause the known carrying of the pregnancy. The known carrying of pregnancy. What does it mean? What is known carrying of pregnancy?
भाई वो क्या बोल कंसीव वहाँ वो कंसीव नहीं कर पाते.
It means that if this is the very simple word, that is the known carrying means failure to maintain the pregnancy. Okay, if the failure to maintain pregnancy, that is the known carrying of pregnancy. That will result in the miscarriage, of course. That result in miscarriage or the spontaneous abortions or the fetal death, and before the 20 weeks. So the primary gravid having acute phlegmonous appendicitis. Maybe in this question they have mentioned something else as well. So that can lead to that is causing what? Known carrying of the pregnancy in this lady. Pyelonephritis of only kidney. Immediate pregnancy intervention. Then we have the Cushing questions. Then we have the placenta with the defect. To make the manual examination of uterine cavity. The same question 26. Contact bleeding plus cauliflower. The cauliflower you have just seen, that is seen in the cervical cancer. Mobile plus bleeding on touch. Don't touch me. Who is saying don't touch me? Who is saying don't touch me? That is the cervix, the cervical cancer. The cancer of the cervix is saying don't touch me. अगर टच करोगे तो कैसा मुंह बन जाएगा उसका? कॉलीफ्लावर लाइक मुंह बन जाएगा. ठीक है. And due to that, what you'll see there is the bleeding has been started. So the bleeding, don't touch me. If you will touch me, I will make the cauliflower, and due to that, the bleeding has will start. And it will be the non-mobile or it can be the mobile. So remember that is the cervical cancer of the uterus. Okay. So there are three things. So, bleeding on touch, cauliflower, plus we have the contact bleeding will be there. Or the same thing that with the bleeding on the touch. Monophagic temperature. Okay, what do you understand by the monophagic temperature and an ovulatory menstrual cycle?
भाई एक मोनोफेजिक तो एक हो गया, मतलब एक ही टाइप का टेम्परेचर रहे. जैसे इसमें मेंसेस आते हैं तो टेम्परेचर बढ़ जाता है, वो साइन होता है इसका एलएच सर्ज में. जैसे वो कि मतलब अभी या तो जैसे 2-3 दिन पहले 1-2 दिन पहले बॉडी का टेम्परेचर बढ़ना स्टार्ट हो जाता है, तो मतलब अभी वो क्या ओवुलेशन होने वाला है मतलब.
Okay, what see in normal ovulatory cycle, if you see in normal ovulatory cycle there is a biphagic pattern will be there. Some space to the see if it is the case of the normal ovulatory cycle. If normal ovulatory cycle, then this is the biphagic. This is the biphagic temperature pattern will be there. There is a two phases. What will be the phases of the ovulatory cycle or the menstrual cycle? Follicular phase, and the second phase is what? Luteal phase. The second phase is what? That is the luteal phase. So follicular phase, there will be the lower body temperature. There will be the lower body temperatures, and the luteal phase, what this means? After the ovulation, what will be there? The sharp increase in temperature. There will be the sharp increase in temperatures due to which hormone? Due to progesterone. Due to which hormone? Progesterone. And the progesterone production by the corpus luteum, that will increase the temperature. So this will become the biphagic temperature pattern. But if there will be the unovulatory cycle, what will happen? There will be the no ovulation. If the no ovulation means no progesterone surge, there will be no progesterone surge will be there, no progesterone will be there, and that will lead to monophagic temperatures. That will lead to Monophagic temperature means temperature will be stable without rise in second half of the cycles. What is the cause of an ovulation? What is the cause of an ovulation? बताओ एक
भाई
चीज
पहला पहला तो ये हो सकता है कि उसके एग्स ही खत्म हो गए हों।
The first cause is what? PCOS. ठीक है, this is the most commonly that causing the anovulations, that the polycystic ovarian syndromes. Other disorders like the stress, thyroid disorders, excessive exercise, if any age-related changes, the medication, birth control pills, or the hormonal therapy, that can also cause the anovulation kind of the problems. You will see the patient will be having irregular periods or the amenorrhea, absence of ovulation, no cervical mucus change, and monophagic body temperature will be there in such patient. ठीक है, take the screenshot if you want to take it. The next one, profuse menses are there. Dense formation in the cervical canals. Uterus enlarged up to 5 to 6 weeks of the pregnancy. Movable and painful. What will be that? देखो, profuse menses, menorrhagia, dense formation in the cervical canal. Dense formation. हर वर्ड का एक मीनिंग होता है. So the dense formation, what they want to say, there is some dense, मतलब some structures are there in the cervical canal. Uterus is enlarged up to 5 to 6 weeks of pregnancy. In the question, they will definitely mention that she is not pregnant anyhow. But still, the uterus is enlarged 5 to 6 weeks. The movable and painful. So it means this is there is some node are there. That is which node? Nascent subcutaneous fibromatous node means. Nascent means budding. Nascent means budding. What does it mean? What is the fibromatous node? What is fibromatous node? देखो, subcutaneous means beneath the skin, nascent means newly developing, or the budding. Budding means newly. They are the firm, non-tender, and usually they are the benign in natures. Okay, the causes of that can be the fibroma, desmoid tumors, dermatofibroma, any trauma or injury to that regions, chronic inflammations like the sarcoidosis. The loads of the regions are there associated with it. But the clinical feature, you will see the firm, mobile nodule. You will see the, just remember, firm, mobile means movable, mobile nodule, new fibrous growth, mostly benign. Okay, tell me about the, if you have the attack of eclampsia, you are going to tie with the vaginal delivery, or will you do the cesarean section?
Cesarean section.
Okay, that you are going for the cesarean section. The delivery by the cesareans. Then you have the chocolate-like discharge. Is seen in which condition? Chocolate-like. This easiest question. Chocolate-like discharge, bursting pain. Is seen in which condition?
Endometriosis.
Endometrioid cyst.
Endometrioid cyst of the left ovary. Second labor lasting for 14 hours plus cervix completely open. Second labor means, what does it mean? Second stage of the labor. Second stage of labor means delivery stage, lasting for how many hours? 14 hours. Cervix completely open means more than 10 centimeter. Small crown is near emphasis. So what you will do? This is the prolonged delivery. So at this times you have to start, because at this time the mother will also be exhausted. So that's why you have to use the use of obstetrical forceps. Do the question 90, 109, 52. They all are the same questions. Sacrum hollow was totally occupied with fetus head. Sacrum hollow was totally occupied with fetus head. ischiatic spine could not be detected. So this is what we call, this is the plane of pelvic outlet. Okay, if you have studied that, just let me know what is that. The plane of pelvic outlet, obstetric outlet. The pelvic outlet simply means you have the inferior or lower opening of the pelvic cavity. Okay. Now, if you talk about the pelvic outlet, it is having the different kind of the boundaries. And this is what, this is the imaginary horizontal, you can say the imaginary horizontal plane. And that marks the lowest point of the pelvic cavity. The plane of pelvic cavity, it marks what? It marks the lowest point of the pelvic cavity. Anteriorly, we will be having the pubic arch. Laterally, we will be having ischial tuberosity. Posteriorly, we have the coccyx. And inferiorly, we have the skin of the perineum. And that is what making what plane. Again, I am repeating. We have the inferior side. We have the skin of the perineum. Posteriorly, we have the coccyx. And laterally, we have the ischial tuberosity, and anteriorly, we have the pubic arch. Okay, and it will make us about the plane. That is a plane of pelvic outlet, and it is what the, like we have said, that it is a diamond shaped out, diamond shaped. It is a diamond shaped plane. And the diamond shaped plane will be there. Okay, and that is causing what? That basically it creating what? It's the imaginary plane that is related to the obvious exit for the baby, and that's why it is and that is what you have to remember, that it's bounded by the puberty arc, ischial tuberosity, coccyx, and the perineum inferiorly. Okay, so that is what in the question they have mentioned, ask you that it is through the, it will pass through which plane? So that is the plane of pelvic outlet. Macrosemia is there. Western sign is positive. What is the Western signs? What is Western sign? लिखा हुआ है, बोलो यार. What is Western sign? बोलो, अरे बोलो.
Child.
It is basically the positive. When we say the positive positive Western sign, see, if there will be the acute peritonitis or the inflammation will be there, that means we have the perineum will be basically, peritoneal will be involved, and we'll call the Western sign positive. And this is the ratio of the head of the child to the pelvis of the woman. The ratio of the head of the child is much than the pelvis of the woman. That is Western sign. So tell me, if the pelvis is small, ratio of the head is big, is it possible for the normal delivery? Of course, no. So for that, what we will do? We will do the macrosomia. If the perineum becomes pale, what you will do? Perineum becomes pale. What does it mean? Perineum pale. The perineum pale during the delivery, during labor. What you will do?
भाई कट लगा देंगे पेरिनियम पे एपिस्टोमी, ये भाई.
What does it mean pale?
पेल मतलब वो प्रेशर आ जाना भाई वहां पे ज्यादा, या
Okay, if you feel the pressures, what you will do? Do the spontaneous episiotomy. There are the two types of the lateral episiotomy and the midline episiotomy. So which one is preferred? What will be preferred? Think about it. Like, let's suppose if you are in the developing countries, what you will prefer? Lateral or midline?
midline.
Lateral.
So what you will do in, if the developing countries, usually we do the episiotomy, that is the lateral. Okay, then why do you do the lateral? See, this is what we have, the vagina, we have the anus here, and this is the perineal region. So we will make a cut here. We will make a cut here. If we will do the midline episiotomy in developing countries, there is due to some, it's not preferable, that it can lead to the complication, the anal complications. It can rupture the anal opening as well. That's why it will not be. That's why it's not done. Usually we done is the lateral episiotomy due to its less complication. ठीक है. blood loss exceeds the PPS, there is no symptoms. No symptoms for the placental detachment. What you will do? No symptoms of blood loss exceed the PPH means delivery. This is which stage? Which stage of the labor?
Fourth.
PPH stage. Fourth stage, the recovery. So we will be having this is just blood loss exceed the PPH, but still there is no symptoms of placental. Placenta still not detached from the. So that is the stage 3. We have to detach the placenta. So what you will do? We have to remove the manual removal of the placenta after the birth. Usually the placenta remove after the delivery, but if in case if it is not removable or not detached from the uterus, then we have to manually remove that placenta after the birth. Left breast cancer T2N2M0. So what you will do? You do the radiation therapy plus operation plus chemotherapy. Okay. Did I explain the staging? Okay, the blood loss, that 100 plus 300 is equals to 400 ml. Exchange card, that is the hygiene question. And the blood loss here, the 100 will be for the like during the labors, and 300 just after the labor, so it is the 400 ml. Then we have the premenstrual syndrome. What will see the premenstrual? There is a very tiny difference in the premenstrual syndrome and postmenstrual syndrome. Just tell me about that. What is premenstrual?
प्रीमेंस्ट्रुअल सिंड्रोम में हेडेक वगैरह होगा और फिर वो बिफोर मेंसेस होगा और फिर ड्यूरिंग भी होगा और बाद में ठीक हो जाएगा। इस उसमें जो ये पोस्ट मेंस्ट्रुअल वाला है उसमें हॉट फ्लशेस वगैरह आएंगे उसको फीमेल को और
bloating and cramps.
Okay. Other symptoms? Did you revise 1 to 50 questions from the lecture, main video, or from the notes? बोलो फिर ऐसे कैसे चलेगा? You have to study. चलो, the premenstrual syndrome basically we have the like it is related to the physical, emotional, and behavioral symptoms, and it usually occur before the pre-menstruation, before the menstruation. That is 1 to 2 weeks before menstruation. 1 to 2 weeks before menstruation, and during the it's occur during which phase? Luteal or follicular?
Luteal.
Luteal phase, because that is the phase before the menstruation phase, the luteal phase. So it is occurring at the luteal phase and shortly resolves after the menstruation begins. So it is occurring 7 to 14 days before the menses, and it is and within the once the menstruation starting. You will see the irritability, mood swings, bloating, breast tenderness, headache, fatigue, food cravings, depression, anxiety. All these are the some emotional, behavioral, and the physical symptoms. And it is linked due to hormonal fluctuations, progesterone and estrogen. Post-menstrual syndrome, it is a less common condition. Okay, this occurs when the menstruation ends during the early follicular phase. You can say it start the post-menstruation. The post-menstrual syndrome, it's less common, they are the very more common. Post-menstrual syndrome, what you will see after menstruation end, and this is basically seen in which condition? Follicular phase. Okay, this is basically if you see the post-menstrual syndrome, they are the less common. The symptoms usually the same like mood swing, anxiety, irritability, fatigue, depression, food craving, and all those things will be there. The another one is there. Another one is the post-menopausal. And there is one more thing, post-menopausal syndrome. What you will see in the post-menopausal syndrome means after the menopause. So in this you will see the physical symptoms, psychologically symptoms, and along with that you will see the urogenital symptoms. That is the main thing. Urogenital symptoms will also be there. Why the urogenital all these symptoms will be there? This is due to estrogen deficiency. देखो, here will the hormonal fluctuation. Here will also be the hormonal fluctuation. But post-menopausal, there will be the estrogen deficiency will be there. There will be the estrogen deficiency will be there. That's occur after menopause, like cessation of the menstruation for the 12 months. What is the cause of that? Estrogen deficiency. And here you will see the what kind of the symptom. Firstly, hot flashes, then night sweats, then flushing. These all are the vasomotor symptoms. What psychological symptoms you will see? There the irritability, mood swing, insomnia, fatigue, depression. All these symptoms will be the psychologically, and these are the vasomotors. You have to remember these are the vasomotor symptoms, like the hot flushing, night sweating, and flushing will be there. Along with that, you see the urogenital. You will see the urogenital symptoms. What you will see in the urogenital symptoms? Urogenital. What you will see? Vaginal dryness. You will see vaginal dryness will be there. The patient will be having the itching. Vaginal itching will be there. There will be the dyspareunia will be there. And urinary frequency, urgency, recurrent urinary UTI, urinary frequency, urgency, recurrent UTI. All these will be the urogenital symptoms will be seen. And of course, after the menopause, the libido will be decreased. The decreased painful intercourse will be there. And skin or hair changes, dry skins, thinning hair, wrinkling will be there. And what are the long-term risk in the menopausals? Can anyone tell me long-term risk? The estrogen help in which one condition in females? If after post-menopausal, there will be the 100% that female will tell us about this condition. हाय मेरे पैर दुख रहे हैं, है ना? So that is because of osteoporosis. Because estrogen is a hormone that help in the bone growth as well. ठीक है? So but the patient will be having the long-term risk that osteoporosis is high. There is a chances of osteoporosis. ठीक है? What will be the level of hormones? Estrogen will be decreased, FSH, LH will be high in this ladies, and estrogen level will be decreased. Then we have the edema, hypertension, proteinuria, eclampsia, history of artificial abortion plus vaginal discharge, sanguinopurulent, that is the post-abortion endometritis. So, artificial vaginal discharge is there, sanguinopurulent, that is the post-abortion endometritis. Defect of placenta after the delivery, the same question. The 40 week secondary para. So, we have the contraction or variative, retraction, like constriction or the indentation. The ring is at the level of the navel. His hypertonic uterus. Then fetal heart, AP of the mother 130. So what is hypertonic? Hypertonic means high tones, contraction active, 40 week. So there is a risk of what? Hysterodoxis. What is hysterodoxis? What is hysterodoxis? अरे बोलो भाई.
Rupture of uterus.
Rupture of uterus. ठीक है? Because of the hypertonic of the uterus. Then after that we will be having the nausea, vomiting 10 times per day. So this is what? Moderate vomiting of the pregnancy. Usually that's occur after, like in the pregnancy. So this is the moderate vomiting of the pregnancy that you have to see. Okay, tell me about this one. Like how when we called it the severe, but mostly questions are from the moderate only. So when we called it the severe. tell me about the moderate severe. And what we call this is the basically the when a patient will be having the nausea, vomiting, so we call this is the morning sickness. And in which you will see the mild nausea, vomiting, that is common in the pregnancy. There is a one more thing that is called the hyperemesis gravidarum. Hyperemesis gravidarum. What is that?
भाई ये भी वॉमिटिंग, ज्यादा वॉमिटिंग.
There is a severe and persistent vomiting. Due to that, you will see the patient will be having the dehydration, the patient will be having the weight loss, the patient will be having the electrolyte imbalance. So hyperemesis gravidarum is basically what we will be having. We will be having the severe persistent vomiting. And if the severe persistent vomiting, that will lead to the patients will come to you with the dehydration. The patient will say they have the weight loss, they having the, and also if you check about the ABG sample, you will see the electrolyte imbalance. What is the ABG sample? That is basically arterial blood gas sample, in which the electrolytes findings you will get. That is the electrolyte imbalance. Okay. What if you have the diagnostic hyperemesis gravidarum? There will be the like vomiting more than 5 times per day, but this will be the persistent vomiting. The severe vomiting, there will be the ketones in the urine, the weight loss more than 5% of pre-pregnancy, the electrolyte disturbance in the questions, dehydration sign in the question. Then you will mention about what? That is what? Hyperemesis gravidarum. Now, if you turn mild moderate, the mild means we will be having less than 5 times. Less than 5 times, less than 5 times means we will be having the mild vomiting. The moderate, remember moderate 5 to 10 times, in which you will see the mild dehydrations. Then we have the severe means we will be having a more than 10. That is the severe dehydration, weight loss, electrolyte loss, that will be comes under the hyperemesis gravidarum. Bloody discharge, weight loss, hemoglobin decrease, SCG positive. What is that? Choreo. Yesterday we had abdominal pain, history of endosublimation 6 to 7 weeks. So that is the chorioepithelium. Barrel shaped cervix is seen in barrel shaped cervix. Somebody has took the name barrel shaped cervix. So remember that is what we have the seen in the cervical pregnancy. Okay, that is seen in the cervical pregnancy. So that is a barrel shaped cervix. Numerous vesicles. That is the which virus?
herpes zoster virus, herpes simplex.
Herpes simplex virus. Herpes, you will see the vesicles. Second stage of the labor, complete cervical dilatation. Fetal head filling the entire posterior sagittal suture lie in anteroposterior diameter of the pelvic outlet. What will do? Application of the forceps minor. So what I told you, there is a minor, there forceps also, minor, major, and all these things. There is a complete cervical dilatation. Second stage is there, fetal head filling the anterior posterior. So there is an anteroposterior diameter of the pelvic outlet. So for that, if you have the prolonged second stage, you have the fetal stage, and if the after coming head in the bridge position means firstly we have the leg will be towards the vaginal side of the vaginal opening. So that will be the bridge presentations. Ill-defined indurations, lactostasis, painful regional lymph nodes, fluctuation object. So that is the lactational mastitis. We have already lactostasis means lactational mastitis. Chocolate color, uterine endometriosis. 9-week pregnancy, fetal tissue palpated orifice, moderate vaginal bleeding. What are the tactics? 9-week pregnancy, fetal tissue palpated on the orifice, moderate vaginal delivery. What will be the tactics?
Vacuum.
Yeah, so we will do the instrumental extraction of the fetal tissue, and see is what? That is the 9-week, right? So we have to instrumental extraction of the fetal tissue either by there is a fetal tissue. Of course, if the 9-week pregnancy, it means that is the case of the abortion can be there. So basically we have to extract the fetal tissues either by the DNC we can do just after the extracting that. Suboccipito pragmaticus. What is that? We have one question we have seen about the suboccipito pragmaticus. So Swati. Where you will see the suboccipito pragmaticus? When it is seen during the vertex presentation. Where will I told you in the lie question that I said in the group. So there is a one lie question out there, the oblique lie, minor oblique lie, and the major oblique lie. So where we have discussed the suboccipito pragmaticus. This is the diameter, and it is present below the occipital bone. Okay, so that is the suboccipit, and where will to the from you can say that from suboccipito pragmaticus. Pragma is what? That the center of the pragma is an anterior fontanelle. So this is diameter from this is the diameter of the length from below the occipital to the pragma, to the center of the pragma. Where we'll see the vertex presentation. Vertex presentation, I have to say that the flexed head. Head will be flexed, and this is favorable for the vaginal delivery. Okay, and this remember that this is the smallest AP diameter, smallest antero-posterior diameter of the fetal skull. And what they indicate? Indicate that the head is well flexed. Okay, suboccipito pragmaticus. What you have to remember is the smallest. This is the best. This is the vertex, means vertex or the flexed head. Smallest diameter, vertex presentation, flexed head. The physiological course of postmortem. So this is again the same thing we have done already. Purulent profuse vaginal discharge. What you have to do? You have to check about the if there is a purulent profuse vaginal discharge. The first you have to check about rule out the bacterial. So for that you have to make the bacteriological and spectroscopic analysis. Okay, tell me the question. Which of the following diameters is most favorable for vaginal delivery? Which of the following diameter is most favorable for vaginal delivery? Options are submentopragmatic, occipitofrontal, suboccipitopragmatic, mentovertical. बताओ. Which of the following diameters is most favorable for vaginal delivery?
Suboccipitopragmatus.
Suboccipitopragmatus. Okay, next one. Which diameter is presented in well-flexed cephalic presentation? Submentopragmatic, suboccipitopragmatic, occipitomental, and biparietal. So, which diameter is presented in a well-flexed cephalic presentation? बोलो बोलो अरे कुछ तो बोलो 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 बताओ. Now again, which diameter is presented in well-flexed cephalic presentation? अभी तो बताया. सेम सब ऑक्सीपिटो pragmatic. देखो, what is vertex? Vertex is what? That is a type of cephalic presentation where the occipit leads. Where the occipit is the ideal. Okay, and the cephalic is what? That is the general term. ठीक है. See, cephalic is what? The cephalic is the general term. If you say the cephalic, this is the general term in which head will be the presentation part. This is the head, it will be the presenting part. Okay. And if we say the vertex, so vertex is what? The vertex is a type of cephalic. Vertex is a type of cephalic where you will see the occiput as the presenting part. Okay, so now see the question again. Which diameter is presented in a well-flexed cephalic presentation? So that is suboccipito-brachmatic. If I say which diameter is presented in a well-flexed vertex presentation, again the suboccipito-brachmatics. I told you yesterday also the type of. Okay, write it here, the types of cephalic presentation. Types of cephalic presentation. So we have the vertex. We have the sinciput. We having the brow presentation. Yes, brow. And we have the face presentation. Then we have the vertex. The vertex, if you say the presenting part, PP, you can write it the presenting part. So that will be the occiput. That will be the occiput. Sinciput, we have the presenting part will be the large fontanelle. Large fontanelle. In brow, the presenting part will be the brow. And the brow, you know, that is the forehead. That will be the forehead. The face, the presenting part will be the hand. Note, of course, not hand. The face bearing part will be the face. The head position. In this condition, if you say, so you can write this is the P, that is the presenting part. The next one is what? That is the, if you say, what will be the position of the head? The head position. Head positions. And which diameter will be engaged? Diameter engaged. Let's see here. So if you are in vertex, I told you what will be the position of the head in well-flexed manner. In well-flexed manner. And if the AP you want to know, that is the suboccipito-brachmaticus. This diameter will be engaged. In the large fontanelle, we have the incomplete flexion. Whenever the head will be in incomplete flexion, the presenting part will be large fontanelle and the presentation will be the sinciput. The incomplete flexion will be there. And here you will see the diameter that will be engaged is the occipito-frontal diameter. This is the smallest, around 9.5 centimeter. Then if we have the brow means when you see the brow presentation, when it will be partially extended. When will be the partially extended? Then the head will be partially extended. You will see the brow presentation or the forehead. And here the diameter that will be engaged is manto-vertical. That is the manto-vertical. And if when you see the face will be seen as the fully extended. If it will be the fully extended, then means we will see the submanto-brachmatic diameter. Okay, now you understand. I know this question was confusing you. The load some questions so not confusing you, but this question was horrible to you. And so you have to remember these presentations. So vertex presentation, sinciput, brow, and the face presentation. Whenever you make your hand in the well-flexed condition, if you make your hand in the well-flexed condition, the presenting part that is coming is what? That is, okay, tell me, is it flexion or extension?
Flexion.
So this is what? Well flexion. So my presenting part will be this one. That is the occiput. If I make it partially extended, what will happen? The large fontanelle will be my presenting part. If I make it partially extended, the brow will be the presenting part. If I make it what? Complete extended, so my face will be what? Presenting part. That's it. And for that, we have the occiput to the anterior fontanelles, we have the sub-occipitobrachmaticus. So that is what you have to remember. The sub-occipitobrachmaticus. Other, if you don't want to remember, forget that. But for that, just remember the sub-occipitobrachmaticus. Okay. After that, 49-year-old hot flashes, climacteric syndrome or the menopausal syndrome. This is the Krok terminology. So that is the post-menopausal syndrome. This is the premenstrual syndrome. Acha, bean-shaped diplococci. What we call is the gonorrhea. है ना, तो acute gonorrheal endocervicitis. Extrauterine pregnancy, uterine tube were removed. Extrauterine pregnancy means
बाहर यूट्रस में नहीं है, उसकी जगह ओवरी वो सर्विक्स में हो सकती है.
ओवरी में cervix fallopian tube है ना. So we have the uterine tubes are removed, possibly of having a child. What is that? What is the possibility of having a child? That is extracorporeal fertilization, means in vitro fertilization, or we do the ART. What is the full form of the ART?
ART.
बोलो. Assisted reproductive technology, or we call that the IVF, in vitro fertilization. There is also the some main type of ART. That is the firstly we have the do the in vitro fertilization. That is the type of ART. Then we can also do the intracytoplasmic sperm injection, ICSI. We have the intrauterine insemination. We will see the IUI. We have the gift or the gift. Gift means we have the gamete intrafallopian transfer, and gift we have the zygote intrafallopian transfer. Okay, so mostly we do the in vitro fertilizations. So this extracorporeal fertilization will be the possibility. ठीक है? Okay. अरे बोलो yes or no?
हाँ भाई ठीक है.
So the extracorporeal fertilizations means we will be having, this is the possibility, or we have the fertilizations outside the body. So that is what we call as in vitro fertilizations, IVF, in vitro fertilization. If you have the, and one we have the, for the surrogacy, what you can use, substitutional maternity, other mother if you choose, that we call the surrogacy. Colicky abdominal pain, bloody discharge, uterus 6 week of gestation, gestational sac palpated in cervical canal. What is that? भाई gestational sac cervical canal में क्या कर रहा है? What he is doing in the cervical canal? What the fuck he is doing in the cervical canals? It should be in uterus. So that's why we call this the abortion in pregnancy. So where the colicky abdominal pain, where the bloody discharge, uterus is 6 weeks of the gestation, but what he still is doing in cervical canal. If his gestational sac is palpated in the cervical canal, this means we have the abortion in progress. Abortion होने वाला है. 6 months ago in natural delivery, complaint of hemorrhage from the genital tract, uterus enlarged of 9 to 10 weeks, heterogeneous consistency, vaginal cyanosis, increase of SCG. What will be there? Increase of SCG. 6 months ago, natural delivery, complaint of hemorrhage from the genital tract, uterus enlarged to the 9 to 10 weeks. She is now not what? Pregnant. But still there is a 9 to 10 weeks uterus enlarged. There is a possibility if we don't have the, if you are just talking till here, it can be the fibromatous node, just we have seen. But there is a heterogeneous consistency, vaginal cyanosis is also the bluish of the vagina, the increase of SCG also. So if increase of SCG, we know that is seen in chorioepithelioma. Bloody discharge from 1 month after the delivery. What you will do? The diagnostic fractional curettage of the uterine cavity. What is Sihan syndrome? What is Sihan syndrome?
Massive bleeding, PPL postpartum time में भाई.
Okay. Anyone else? Only one person is attending the class. Why others are sleeping?
We can see weight loss. Sorry.
Sir, tell me what is Sihan syndrome? What you are studying?
भाई ये पिट्यूटरी की दिक्कत हो जाती है, पिट्यूटरी नेक्रोसिस हो जाती
इनको
है।
इनको बताने दो, रुक जा 2 मिनट। इनको what tell me Sihan syndrome. Yes, Rose, you can speak without raising a hand.
Okay. The Sheehan syndrome, it's let me say it's a disorder that occurs after a woman gave birth and there was too much bleeding. There was a profuse postnatal hemorrhage or postpartum
Mm-hmm.
hemorrhage. So there will be a kind of necrosis of a part of the pituitary gland, and this will decrease the production of gonadotropins, leading to amenorrhea, um,
Mm-hmm.
a kind of weight loss, and also hair loss.
Okay. What others? Will be the milk production will be there?
I don't
No.
know. There's no milk production,
No.
just
No. Will-
amenorrhea, hair loss, weight loss, and
Okay. So Sihan syndrome, basically we have the, in the one word if will say, that is the postpartum hyperpituitarism or hypopituitarism.
Hypo.
Hypopituitarism. So Sihan syndrome, just simply remember, this is a very important one. That's why I'm asking you again, because you get the one question. There are lots of the question of the Sihan syndrome, so the most probability you will get one question in exam. Sihan syndrome, if you'll say that is the postpartum, that is the postpartum hypopituitarism. Okay, and it's caused by what? Ischemic necrosis. It's caused by ischemic necrosis of pituitary gland, of pituitary gland. And it's why it's occurred due to PPH. It's occurred due to PPH, postpartum hemorrhage. What you are going to see here, the cause here is the massive blood loss during or after the delivery. That will lead to the hypoperfusion or the infarction of the anterior pituitary, and due to that, this enlarged pituitary during the pregnancy make it more vulnerable. Okay, देखो, first of all, we will be having the bleeding, the postpartum bleeding. Postpartum have severe bleeding will be there, and that will lead to the hypoperfusion and the infarction of the anterior pituitary. The enlarged pituitary during the pregnancy make it more vulnerable. So we have the pathophysiology. If you'll see what the cause behind it, that the anterior pituitary will be damaged. Now, if tell me if the anterior pituitary will be damaged, the anterior pituitary, the necrosis, it will be necrosis of that, it will be damaged. So what will happen? The decrease of FSH, decrease of what? Prolactin. There is a decrease of what? There is a decrease of LH, FSH. There is a decrease of ACTH, TSH. All those hormones will be decreased. Anterior pituitary hormones will be decreased. So what are the symptoms? The symptoms usually they are delayed. It takes the weeks to the months. But what are the symptoms? If there is a decrease of the prolactin, there will be the agalacturia. There will be the failure to the lactate. There not no milk production. There is a no milk production will be there. If there is a LH or FH will be decreased, what will happen? There will be the patient will be having the amenorrhea. The patient will be having the decreased TSS. TSS is responsible for the basal metabolic activity. Because of that, it stimulates the T3, T4 hormone. Due to that, you will see the fatigue. There will the decreased TSH will decrease what? They're causing the hypothyroidism. That will causing the weight gain, cold intolerance. Hypothyroidism symptoms will come. Decrease of ACTH will cause the hypotension, weakness will be there, and due to growth hormone there will be the generalized weakness, energy will be lost because growth hormone also responsible for the energy production. Okay, so women will be having the severe bleeding during the delivery. Now no milk productions, no amenorrhea, the fatigue will be there, cold intolerance, low blood pressures, less energy, weakness will be there, lots of the things will be there. So first that for making the diagnosis, you have to check about if any history of the PPH plus clinical examination you will do, and your hormonal checkup you will do, in which you will see the decrease of anterior pituitary hormone. What you will see in MRI? This is your question. What you will see in MRI? What you will see in the MRI?
Empty cella.
Empty cella or the pituitary atrophy. That is the empty cella trasica. What is the cella trasica? The cavity where the pituitary glands located. So they will see the empty cella, or you will see the pituitary atrophy. Okay. So Sihan you can easily understand. Sihan means the sudden hemorrhage and endocrine hormonal activity now. What is that? Sudden hemorrhage and endocrine hormone activity now. So that is what we have the here. Sudden hemorrhage and endocrine hormone activity now, due to which we will get the symptoms. Okay. So we will be having here, that is the difficulty, labor complicated by the massive hemorrhage. So that is the Sihan syndrome. Risk of abortion in the 9th week of pregnancy. Labor activity begins 6 hours ago. Cervical dilatation 4 centimeter. Which stage?
First.
Stage 1.
Stage 1. Okay. So the labor activity began 6 hours ago. पर cervical dilatation force है. History of so what will happen? There will be the discoordinated labor activity. देखो labor activity पहले first stage में start हो गई. So that is the discoordination between the labor activity. So this is the easiest question, but you have to think according to the questions, according to the options. 14-year-old girl, juvenile girl है, pain in vaginal area, vaginal membrane is intact. Sorry, vaginal. This is a vaginal membrane is intact. Then cyanotic and protruded, never had menstruation, diagnosed with primary amenorrhea. There is a what we call hymen atresia. What is meaning of hymen atresia? देखो 14-year-old girl menstruation हो जानी चाहिए थी अब तक, है ना? There should be the menstruation till now, but now she is having got primary amenorrhea, never had menstruation before. So what can be the reason? And she having the pain in the vaginal area. What is the sign we'll see in the hymen atresia? What sign you are going to see in hymen atresia?
भाई लोअर एब्डोमेन पेन होगा, क्रैम्प्स होंगे, लेकिन वो कोलेक्शन हो जाएगी वहां, तो फिर उसको
ठीक है. Lots of the things will happen. Just tell me one word that sufficient. First of all, we will be having the im. This is what im hymen atresia. Basically, we have the imperforate. We have the imperforate hymen, and this is what congenital malformations. Okay, where hymen fails to imperforate. Now it's blocking the vaginal opening, blocking the menstruation. Now see, if we blocking the menstruation, what will happen? Normally what happens, the central hymenal membranes break during the fetal life. But if it is failure, we call this as imperforate hymen. Now, if it is a menstrual blood will accumulate behind it. So due to it, what we'll call it? Hematocolpos. We call it hematocolpos. It means there is a blood behind the vagina. That is called the simplest word, hematocolpos. And due to that, now this blood will becomes the dark, and due to that, the cyanosis will occur. So the main thing that you have to remember, if you see that some cyanosis will be there. The teenage girl bulging bluish membrane at vaginal introitus. So that is bulging bluish membrane. This is a very typical word that you are going to see in bluish, PLU. Bulging bluish membrane. So bulging bluish membrane, urinary retention, constipations, or at vaginal introitus. So you are going to see the hymen atresia. Okay, what tell us about the keywords? What keywords should see in the hymen atresia first? Bolo. Hello.
Absence of menstruation.
No
Cyanosis.
menses. No menses, but cyclical pain will be there. Second,
Cyanosis.
cyanosis, bluish membrane, bluish bulging hymen. Okay. Teenage girl. The main thing first thing, the teenage girl, no menses, cyclical pain, mass felt in the lower abdomen, bluish membrane. Okay. So that is what making what hymen atresia. Usually the clinical examination is what? Enough. Okay. You can remember hymen atresia, hymen closed, periods trapped. Irregular intense labor pain last for 36 hours. There is irregular intense labor pain last for 30 hours. Close orifice, mucus discharge. What is that? Orifice is closed, mucus discharge, irregular intense labor pain. What is that? The one thing we have studied, that is pathological preliminary period. What is that period? बोलो भाई, बोलो दिमाग लगाओ. What is pathologically preliminary period during the labor? अरे preliminary period means before the delivery. So which stage? Which stage will be there?
Stage 1.
That is the stage 1. So stage 1 means latent phase. So that is the preliminary period. Preliminary period means that is the latent phase they are talking about. That is the initial phase where the cervix will soft, efface, begins to dilate. Okay, when it will become pathological, we call this is a pathological preliminary periods. Why we call the pathological? देखो, irregular intense labor last for 36 hours. Orifice still closed. It means it become pathological. There is an abnormal progression in the early stage of the labor is called pathologically latent phase or pathologically preliminary period. See, again, if there will be the abnormal progression in early stage of the labor, we call this as the pathological. If the mucus discharge is also there, that is also tell us about the pathological condition. That is a so simple thing. Okay. If duration of more than 20 hours, we call this is the prolonged latent phase. Okay. In basically, we have the more than 24 hours. Just let's see here. See, we have seen that there is a latent phase. And the latent phase, we also calling this phase that is the preliminary period. And this is which stage? Stage 1. Stage 1, which phase, how many phases are there in the stage 1?
2.
The first phase is
Latent and active phase.
okay. So the latent phase is what? That is the preliminary period. The preliminary basically means initial period. And that is stage 1. So what will happen? Usually, if you will say, when we call it prolonged, if more than 20 hours in nulliparous movement and more than 40 hours in multiparous movement. What is the nulliparous or multiparous movement?
नल्लीपैरस मतलब कभी वो मतलब चाइल्ड बर्थ नहीं किया है, कभी प्रेग्नेंट नहीं हुई है वो पहले, ये उसका बच्चा
he didn't have the childbirth before, and multiparous means having the already child already. So with the more than 40 hours, 14. So more than 14 hours. More than 40 hours in the multiparous movement, we call this as a prolonged or pathologically preliminary periods. Okay. Another things we call it the pathological. Another pathological conditions we can say that if there will be the irregular ineffective contractions and ineffective contractions, no dilatation. Okay, so that we call it a pathological. If you still don't know about any such thing, just remember, if there is intense labor pain lasting for many hours, there is no cervical dilatation. If it is the stage 1, the labor has been started, there should be the cervical orifice should be open either by 1 centimeter, 2 centimeter, but it should be open. If it is not open, that is means pathologically preliminary period. You don't know about the preliminary period, just see all the options and choose whatever is coming in your mind after seeing the question. There is irregular period, or if it's labor started, or if it's not open. It is, according to you, it is what? It is the stage 1. But it's stage 1, still it's not open. It means there is some pathology as there. You have seen the pathology, mark that answer. RH antibody reveals, so it is once a week. 38 week plus 2 1, that is the pitoplacental insufficiency. Usually if it is a term, that should be more than 2.5 kg, and if it is 38 weeks 2.1 kg baby, definitely this is the IUGR case, that that is known as the pitoplacental insufficiency. Unable to get the pregnancy for 5 years. What are the tactics? In vitro fertilizations we can do. Uterine fibromyoma is there, then you go for the surgery. Bloody discharge for the 3 hours, LMP 3 months back, 10 week of gestation, small vesicles in uterine cavity. What we call this as the grape mole. What is another name of grape mole? What is another name of grape mole?
Hydrated mole.
Hydrated mole. Okay, so there is a bloody discharge for the 3 hours. LMP was 3 months back, 10 week of gestation, small vesicles in the uterine cavity, grape mole, fibromyoma, urgent surgery, salatricica means pituitary tumor, inability to become pregnant for the 3 years. She is infertile. Hirsutism is there. Oligomenorrhea is there. Weight gain, enlarged ovary, multiple cystic inclusion. Everything is mentioned in the question itself. So that is what PCOS, polycystic ovarian syndrome. This is a very common thing of the PCOS. Hirsutism, infertility, oligomenorrhea, weight gain, enlarged ovary, behavioral changes, and multiple cysts will be there, and androgens level will be increased. Bloody discharge, cyanosis of vaginal mucus, clean cervix, lower pain of gastric sac visible. Woman is 10 weeks pregnant. What is the tactic? Curettage of the uterus done at having bleeding. Surveillance done at low bleeding. Okay. If we will be having the heavy bleeding, okay, so we will do the curettage. Okay. Then what is done at heavy bleeding? Surveillance means done at low bleeding. Surveillance means done at low bleeding. Placenta with defect. What you will do? This same question that we have done before. That is the perform manual investigation of the uterine cavity. What you will do if the endometritis? What prophylaxis you will give? Antibacterial and uterine massage. Okay. Then 10th labor and labor activity started. What you will do? So 10th labor. See, she is 10th time pregnant. Labor activity starting. Suddenly stopped with a knife-like pain in the lower abdomen, positive symptoms of peritoneation, fetal heart is 0. There is 2 conditions are there. The first one is the uterine atony, because she is 10th labor is there, 10th time pregnant is there. So due to that, she can be having the decreased tone of the uterus, and decreased tone of the uterus, that also there is a sudden stop with the knife-like pain. So they have cleared us that the peritoneal irritation, and now there is a positive. So Bloomberg sign is also positive. Rebound tenderness is there in this patient. Fetal heart rate is 0. It means there is a high chances of the hysterorexis, the rupture of uterus. Okay. Infertility rate plus endometrioid cyst. What you will do? Surgical laparoscopy. Same question. The second day of postpartum and the lochia. Tell me what is lochia? Loki
Discharge.
लिक्विड आता है जो आफ्टर डिलीवरी जो लिक्विड
Metralochium.
Vaginal discharge.
vaginal discharge that occurs after childbirth.
Delivery.
Delivery.
That occurs after childbirth. Consist of what will there? Blood, mucus, or the uterine tissues. Where it will be from? The placental tissue. Now tell me about the lochia. See, the lochia is basically we will be having that is the vaginal discharge. the vaginal discharge after child birth. Okay. Now lochia, if see, they have the three types. Can you just tell me the name?
Lokia,
Rubra, alba.
Sirosa,
By sequence wise. Just tell me sequence wise.
पहले रुब्रा,
Rubra, Sirosa alba.
alba.
Okay. So what you have to Russell. That is the. So we have the lochia rubra. Lochia rubra. So initial discharge, that is the after post delivery. What it will contain? What is the day? Day 1 to day 3. What it will contains? Initial discharge post delivery. That is the initial discharge. What will be there? Blood, placental tissue will be there. Blood and placental tissue will be there. We have the lochia serosa. Serosa means which kind of the discharge? This of course blood. We have the reddish discharge. Pinkish. That is the pinkish or brownish. Pinkish or brownish discharge. And due to mixed blood or serous fluid. Which day? Day 4 to day 10. Then we will be having the lochia alba. So what is that?
whitish,
Yellow white.
Whitish, because they have the whitish yellowish. Why the whitish yellowish? Because of
Leukocytes
WBC
and mucus.
mucus. Okay, and it will be from day 10 to 6 week. ठीक है, अभी कोई पूछेगा तो बता दोगे. Any pregnant lady will ask you that there is some discharge from after the childbirth. Is it normal or not? Yes, it's normal. It's vaginal discharge. It's occur in all the females after vaginal or the cesarean delivery, and discharge gradually decrease in the amount. You have to tell that discharge will gradually change in the color over the several weeks. If discharge having the foul odor, then this is abnormal, and that it means indicate infection. So first you have to ask that is there any foul odor or not. If any foul odor, it means this is infection, and if it is normal, no odor is there, that it means there will be. If no odor means there will be the odor, that is we will be having the normal discharge. Okay, if you have excessive bleedings, like if the pad will be saturated in less than 1 hour, so that we call the postpartum hemorrhage. Okay, it can be the prolonged lochia rubra. Okay, in which when we will say the prolonged lochia rubra, if the placental fragments or the lacerations is possible, then it can lead to abnormal lochia rubra. If there the foul smelling lochia will be seen in endometritis or the infections. Okay, so you have to just observations. In all these cases, what you have to do? Just observe or reassure the patient. Okay, you can remember it with the help of Rushal. Okay, so you that RSA. You can remember it with the help of RSA sequence. That is the rubra, serosa, alba. Rubra, serosa, alba. Rubra, serosa, alba. ठीक है? और you can remember रशिया गुंडों में फंस गई, वो वाले रशिया याद करना ताकि याद रह जाए. ठीक है, so Russia, that is means we have the R, we have the serosa, and we have the alba. Russia, that is Russia गुंडों में फंस गई means rubra, serosa, alba. Rubia, serosa, alba. ठीक है. हाँ, so this is the lochia. This is the second day of postpartum. मतलब कौन सा रुब्रा आएगा? So bloody. First 3 to 4 days red. Dense tumor without distinct outlines. Axillary lymph node. देखो, breast cancer metastasized to which node? Lymph node. Breast cancer metastasized to which lymph node? ब्रेस्ट कैंसर मेटास्टाइज टू विच लिम्फ नोड? बोलो भाई,
Axillary
बोलो।
lymph node.
Axillary lymph nodes and parasternal. Metastasize to the axillary lymph node and parasternal lymph nodes. ठीक है, तो just remember this. So dense tumor without distinct outlines. Without distinct outline means metastasis. ठीक है, अगर distinct outlines means benign. ठीक है, so this is the distinct out without distinct outlines. This is the breast cancer. Breast pain is there. Body temperature 39 degrees Celsius. Hyperemia is there. Infiltrate with the area of softening and fluctuation. So fluctuation means abscess. Fluctuation means abscess. Hyperemia is there. What is the meaning of hyperemia? Redness. ठीक है, hyperemia means redness will be there. Then infiltrative purulent mastitis. 49-year hot flashes, post-cachextrial syndrome. What is post-cachextrial syndrome? Post-cachextrial syndrome. What is that? बोलो, तुमने पढ़ाई नहीं करी।
इसमें ना हिस्टेरेक्टोमी करते हैं सर्जरी के बाद, उसके बाद भी प्रॉब्लम आती है हॉट फ्लैशेस की, शायद उसी को कहते हैं।
What is the another name of post-cachextrial syndrome? You have not studied well and good.
Post-intensive care syndrome.
Post-intensive care syndrome. What is post-intensive care syndrome? Please explain me.
Basically, it is a collections of health disorder.
Collection of health disorders that occur in the intensive care unit, है ना? खुद से बना बना के लेके आ रहे हो।
Climacteric.
अरे that simple thing. Post-menopausal syndrome, also known as the post-cachextrial syndrome. This is the Krok question. The Krok terminology tells us that post-menopausal, also known as the post-cachextrial syndrome. This menopausal syndrome, post-cachextrial syndrome. 48 year plus lower back pain plus constipation. ऐसी छोटी मोटी गलती ना करें. Don't do such silly mistakes. है ना? There are the very few questions are there. That is a direct questions. You don't have to think. If you're 49 year
Sir?
post-cachextrial syndrome, mark that answer. हाँ.
क्लाइमेक्टेरिक सिंड्रोम भी यही होगा ना, सेम?
क्या होता है climacteric syndromes? तो what is the premenstrual?
प्री मेंस्ट्रुअल नहीं, पोस्ट टाइम पे हो रहा है ना क्लाइमेक्टेरिक सिंड्रोम, सेम हॉट फ्लैशेस।
हाँ.
Same है ना?
See, these are all are what we have the same things, but these all are the Krok terminology. ठीक है? It is basically, if you see the climacteric, that means you have the transition. This is basically the transition syndrome, where you will see the transition from the reproductive phase to the menopause. Okay, so that is what pre-menopausal syndromes you can say. That will be the best. But if it's not in the options, if it's only the post-menopausal syndrome is in the option, then you go towards the what is the climacteric syndrome, post-menopausal. ठीक है?
Okay.
There's very tiny difference. You can say that this is the post means cachextrial, and if you have the pre-post-menopausal, because post-menopausal. If it is a pre-menopausal, that is the climacteric. Transition from menopause to transition from reproductions to menopause. And if it's still not that option, if only the hot flashes, the symptoms will be basically same. ठीक है, hot flashes will be there, menstrual irregularity. So that's why you can see, but the difference is the very tiny difference, that this is what pre-menstruation means. We have the menopause, the last menstrual periods confirmed after 12 consecutive months. If the 12 consecutive months in the option, then you can go check what the climacteric syndrome. 48 year plus lower back pain, constipation, uneven surface atypical. Then what is the hysterocarcinoma, uterine carcinoma, uterus corpus cancer. Then we have the not having the menstrual period for 7 months. Menarche was 13 years, secondary amenorrhea. The menarche already done, but after that there is a not having period, so that is the secondary amenorrhea. If we having the not menarche was not done, then this is the primary amenorrhea. Skin, lemon peel, breast cancer, pseudourine, self-detected tumor, young age is known as fibroadenoma. Which is the self-detected tumor? Which is self-detected tumor?
Fibroadenoma.
Fibroadenoma. This is the breast tumor, benign tumor. 22-year memory tumor, big formation, increased echogenicity, fibroadenoma. What you will do? You have to remove a tumor prior to the pregnancy. The surgery, like you have in the question, they mentioned that will you continue the pregnancy or something like that. So first you have to do removal of the tumor prior to pregnancy, because it can usually it is not having such kind of the problem, but it is if it is creating the problem in the normal life, then you have to surgically remove it. Milk discharge, galactorrhea, amenorrhea, increased serum prolactins. No need to tell that hyperprolactinemia, pain, heaviness in the left breast, edematic hyperemic, fluctuation is absent. So see question 27 on 67. Nipple discharge, drop of the milk with paste, diagnosis will be the mastitis. That is the lactational mastitis. So this question already done. After that we will be having the so what is the treatment they are asking? Treatment, antibiotic therapy, and again immobilization and expression of the breast milk. So we have already seen that contain the breastfeeding milk or the expression of the breast milk, pumping of the breast milk is the treatment, and antibiotic therapy because we have the some infection as there. After 20-minute delivery, the temperature rise to 38 degrees Celsius. Bloody lochia, breast are soft and painless. So what you have to do? देखो bloody lochia means bloody discharge हो रहा है, तो तुम क्या करोगे इसको? You have to come to the hospital and ask. There is a very serious problem, right?
Normal life, physiological.
So this is a normal physiological condition. So no need to do anything. Just reassure the patient. Primary gravida, irregular contraction, intensity of the uterine contractions, no changing, no cervical dilatation. What is that? Again, irregular contraction, intensity of uterine contraction, no changing, and no cervical dilatation. That means preliminary period. When we call it active labor, when there is increase and the uterine intensity of the uterine contractions keep increasing, plus frequency of contraction will also increasing, and cervix start to dilate. 27-year-old physical emotional symptoms pre-menstrual. देखो आगे ना कि इसको बोलते हैं क्या? Climacteric syndrome. Physical emotional symptoms problem 5 to 6 days before menstruation, disappear after the menstruation, pre-menstrual syndrome. Then we have the 38-year-old hot flashes, history of extirpation. What is the? देखो ये सब these are the terminology you have to remember. Hysterorexis, extirpation. So that is the post-castration syndrome. 13-year-old girl, heavy bleeding, juvenile bleeding, 13-year-old girl. RH isolation, decrease in the RH titer. What you do? Severe hemolytic anemia. What we call this condition? Erythroblastosis fetalis. Okay. So if you have the RH incompatibility, if RH incompatibility, that is erythroblastosis fetalis. Okay. So what you do? Premature. What you have to do? Premature delivery if it is RHI. Usually now we will give the injections. Okay. That is which injection is given? Anti-day injection is given if she is. Okay, RH incompatibility possible in which cases? RH negative mother and RH positive father, or child. If the children is RH positive or father is RH positive, mother is RH negative method, then we will see the RH incompatibility. Okay. अगर मदर को नेगेटिव रखोगे, इफ यू मेक द मदर नेगेटिव, ऑफ कोर्स द इनकॉम्पेटिबिलिटी विल अकर. इस तरीके से याद रखोगे इसको तो कभी नहीं भूलोगे. मदर को अगर नेगेटिव रखोगे, इफ द मदर यू विल मेक इट ऑन द नेगेटिव, देन देयर द RH इनकॉम्पेटिबिलिटी विल अकर. ठीक है. If mother will be positive, everything will be positive. If mother will be negative, everything will be negative. Everything will become incompatible. For this, you have to remember like that. If the mother is RH negative, RH incompatibility will occur. If mother is RH positive, everything will be positive. There is a no RH incompatibility. Done.
Done.
Okay. So we have finished the OBG revision. So now your target to finish the complete base. Now send me there's one more homework for today, that you have to send me the screenshot with more than 96% base questions. 96, why 96? 98%. More than 98% should be there. ठीक है. Send me your base questions screenshot. ठीक है. Can we do the PD also today?